Well, welcome to the 7 o'clock talk. And tonight we're doing a rant.
Say whoa! I mean, whoa!
I normally get to do this rant in the clinic when talking to people face to face, but this is something that just needs to be recorded and needs to be put out there. I'm going to talk about the rankings of the United States in healthcare as it pertains to us versus the other large countries in the world. And we like to think that we are the ultimate when it comes to healthcare. Oh, we have the best healthcare. Oh, we have the latest and the greatest. And then now we have these, oh, follow the science. It's the science. I just get sick of hearing it.
You do not need to wear a mask indoors if, in fact, you've been vaccinated. Good that you're vaccinated, but in a situation where you have people indoors, particularly crowded, you should wear a mask.
So even if you are vaccinated, you should wear a mask. If, in fact, you are vaccinated, fully vaccinated, you are protected, and you do not need to wear a mask outdoors or indoors.
At this point in time, what has our science got?
Science has gotten us nowhere, really.
So I'm just going to say some stuff and I'm going to read some things. She and I will comment on it, and your comments are welcome. What I did was I went in and I did a comparison, and I wanted to know how the United States healthcare system compared to the other countries globally. In the comparison, it looked at access, equity, outcomes, efficiency, and overall quality. One of the neat notes about this is it said, despite spending the highest percentage of GDP, which is gross domestic product, and we are one of the top grossing countries in the world, we spend nearly 18% on 18% on our healthcare. Do you know what the other countries around the world on average, we spend the most. We spend the most per person on healthcare in the world at 18% of our GDP. Do you know what the average GDP cost is? Do you know what, you want to take a stab at what the average GDP cost is?
I have no idea.
So we spend 18% on average. The rest of the world spends 9%. So not only do we make the most money in the world at GDP, but we spend twice what they spent. So that is absolutely crazy. So did you catch that?
No, I had important things like conversation with Ray Baby.
So our GDP, I don't know exactly what our GDP is, but we're one of the richest countries in the world. We spend 18% of our GDP on healthcare. On average, all the other countries, on average, spend 9% of their GDP on healthcare. So not only are we one of the richest countries in the world, but we spend exponentially more.
I have lots of, I can rant all day long on why I think that's the case, but it's not for health reasons.
No. And so I actually asked the question, compare the United States worldwide on these metrics to other countries worldwide on these metrics. And it basically came back and said, there is no comparison because these metrics actually didn't start to be followed until the 2000s. So we don't have metrics on what we spent for healthcare prior to 2000. So here is an interesting thing. 2000, when the World Health Organization actually did the first analysis. We ranked 37th out of 191 countries. I don't know about you guys. I would think we would do a lot better. And this is in the year 2000. What are your thoughts on that? 2000, 25 years ago, we still only ranked 37th out of 191 countries.
It doesn't surprise me. I have lots of thoughts, but I'll get off topic.
Well, you can get off topic easily. So let's talk about the first one that they actually reported on. This is 2024. So I want all of the follow the science people. Our science is second to none. Our science is the best science in the world, blah, blah, blah. I want you all to hear this. Out of the 10 high income nations, Australia, Canada, China, whoever, out of the 10 highest, guess where we ranked?
Out of
Out of the 10 highest income producing countries,
we're not in there.
where did we rank? No, they only ranked 10.
So are we within the 10?
Yes, we are.
10.
Yeah, we were last.
Shane, if you ain't first, you're last. You know what I'm talking about? That phrase is trademark, not to be used as a position of Ricky Bobby.
We were last because they didn't include the other countries that weren't high income countries. Australia beat us. When has there been? I don't know of any medical innovation coming out of Australia.
We say innovation, but is it really?
Okay, healthcare. I mean, when I think of healthcare, I think of our doctors and our hospitals and our emergency rooms. I think they should be ranked some of the highest in the world, and they're not.
I disagree with you.
Okay,
I don't think that we have health care. I think we have sick care.
we do.
We do very well with traumas, and outside of that, we do really good with making appointments to generate money.
Actually, we don't rank really well in traumas. It was.
Well, we thought we did. I should say.
I thought we
Based on
did.
the science, we
Yeah.
aren't.
Based on the science
We're
and what
very-
we're told.
You are more likely to die from going to a facility.
Yeah. So on the Commonwealth Fund in 2024, we ranked last. Australia, the Netherlands, the UK, they all ranked higher than everybody was above us. We are second in the care process. So our nurses, our intake, our ability to assess the patients ranks us second. Our weakness, we are last in access, we are last in equity, and oh my God, we're last in outcomes. It's not the people, it's not the nurses, it's not the intake, it's the application of the knowledge. It's the application of this advanced science that we have that has us last.
No issue.
I am just reporting what is out there, the actual numbers, the actual statistics, so we can put to bed all of this stupid, our science is the best and we have the greatest healthcare, blah, blah, blah.
Yibbies.
So our intake, our sitting down, our nurses taking time with the patients and figuring out everything and noting and getting to a diagnosis, we rank second out of all those 10 countries. Then when we apply our tools, we drop to 10th. Our outcomes put us at 10th.
And I know why.
Why?
Well, I can, for instance, so I have somebody calling me. We have people call us all the time. I have lots of family that calls me all the time, and I always try to answer. And I'm getting old and maybe crotchety because I don't care to hurt feelings, I guess, anymore. And I'm not intentionally trying to hurt feelings, but sometimes you just gotta just tell people the truth. And so I get a phone call today, and actually it's really sad because a lot of these people live on disability income. And I don't know if anybody has anybody in their life that has a disability income, but it's not a lot. We're less than $1,000. And then they have to pay for their Medicare, and they have to pay for their supplement if they choose it. They don't have to have it. They can choose to have pharmacy benefits. And we're not even going to get started with the advantage plans, because you can ask any nurse that's been a nurse for any length of time, and they will tell you to not stray from your traditional blue Medicare. But not to stray off our topic too far. But anyway, they get sicker and sicker. And over time, if you are seeing the best of the best, and we supposedly have the best healthcare system, you would think the more doctors and specialties and things you have in your corner, the healthier you get. But that's actually not the case. I feel like people get sicker and sicker. So this particular person called me today, and this particular person is near and dear to my heart. And but I listen to people, and they put all of their eggs in a healthcare basket. And it's so frustrating to me. So today it was on lab work, and I'm going to have to go to another doctor. And I'm like, why? Like, what do you need to go to the doctor for? Well, I have high ferritin in my blood, and I have hemoglobin issues. And now I have to go to see a hematologist. And I'm like, but why? So this person sees a hematologist, an oncologist, doesn't have cancer, a GI doctor, a kidney doctor, primary care, a cardiologist, a rheumatologist. Am I missing any? I'm sure I'm missing a few, but you get the gist of it. And so each one of these specialists cost a little extra outside of what Medicare pays for, and each one of them provides a script, prescription. And so I'm listening, and then I'm like, well, what's the reasoning next specialist? Well, she's like, I have too much ferritin. Okay. And my hemoglobin is low, and I have low iron, and I have low iron on my cells, but I have more ferritin. So I haven't seen the lab, so I'm just going off of what she says. But I always tell everybody, you can get a few things every single time you walk into your primary care. You can usually always get a prescription for a PI, an acid reducer, and you can get a handful of referrals. I get so frustrated because I'm old,
You're
old,
older.
and I still remember going and seeing a doctor. My mother, when she would go to the doctor, her doctor was her doctor when she was a baby, was her pediatrician, took care of her into adolescence, was her OBGYN, delivered her babies. If she had high blood pressure, he took care of it. If she had diabetes, he took care of it. He was a one and done, one stop. You didn't leave his office with umpteen referrals. I would hope that we weren't dumbing down our medical, but I do get tired, and I personally experience this is when you walk to a physician's office, and not all of them. Please don't take them as I'm talking as a whole, because I know some fabulous medical doctors, and I know some fabulous internal medicine doctors.
And we try to push people
And
to them.
yes, we do. And I know you can name every specialty, and I know some fabulous doctors. But as a whole, our patients and people that call us say the same thing. And I've experienced myself. Like, I don't know what to do with you. So you leave with a endocrinologist appointment, you leave with a rheumatologist, like you leave with a whole slew of other appointments, and that takes another piece of their income. And they also get a script, whether it be a prescription medicine or supplement, and takes another chunk of their income away. And they literally are living to go to the physician's office. And when they do ask questions, they are met with, I only deal with this. So whether it's I only deal with the heart, or I only take care of diabetes, or I only take care of this. And when did we just stop looking at people as a whole, at least trying to fit the pieces together? And so why can't we understand, if you put somebody on a PPI 3 times a day, they aren't going to have stomach acid, and they're not going to break down their food. Therefore, they can't digest their iron. They can't make their amino acids. They don't have vitamin B. Like, we will go around the circle all day long, but ultimately, you actually hold the key to your health. You yourself personally hold the keys to your health a lot of the times. Not all the time, but a lot of the times. And it starts with good nutrition, good water, movement. But you have to be able to utilize the nutrition that you're taking in.
And you shouldn't need you shouldn't need a doctorate to eat.
No, and you should be at least be able to the dots. Like, oh, you don't have any iron. Oh, you're taking a PPI 3 times a day. Oh, you don't have stomach acid. Anyway, I just think those are common sense things, and I think it's kind of criminal that a person in their 60s or 70s or younger even has to see a multitude of specialties, and yet they still don't get answers, and they still feel bad, and none of them talk to each other.
Along those lines, in the Commonwealth Fund, they also found that America has the lowest life expectancy at 77.5 years. And this is a stunner. We have the highest avoidable deaths. What does highest avoidable deaths mean?
Are you talking all deaths?
It just says we have the highest avoidable deaths. So basically,
Well,
we're
this is
doing
fine.
we're doing so much stuff, and we're not paying attention to the patient, and they're dying.
God bless old nurses. God bless old nurses, and we're losing them. We've all left. We've all left the bedside. And my Two North family, that I had the most amazing nurses that raised me up when I was a baby nurse. They would always tell you, pay attention to the patient regardless of what your machines or your numbers were saying, because you can sit and watch the numbers, and your patient will will expire on you.
You can just stand there and watch them die. So next, we're still in the 2024s. FREOPP, FREOPP, World Index of Healthcare Innovation. When we look at the 32 high-income nations, and so now we're talking about healthcare innovation, we rank 7th. Now I would have thought we would have been top 2 or 3, but we're in the top 7. Switzerland beats us in innovation. Ireland beats us in innovation. Germany beats us in innovation.
And so when I think about those people, I think about the doctors that were doing research on their own. We can take an example. Riley, Riley Children's Hospital used to be top notch. Like that's where everybody wanted to go. They had the most amazing physicians there. And not only did they have a thriving practice, they were doing their own research and getting grant monies and things like that to do it. I don't know who decided that they weren't going to be able to do that, but we lost wonderful physicians because if they weren't able to do the research and do studies for themselves, they weren't going to stay well before 24. But, you know, my daughter was born there. Like I, she probably wouldn't have been alive without those handful of fabulous physicians. And not one of them practices there currently because they left for bigger and better things or they left being a physician completely because they weren't able to do the things that they love.
So in that report, we actually rank first in scientific advancements, research and design, new drugs. That's where we come in hot and heavy. We're number 1. We're 6th in choice, and we are last, 32nd in fiscal sustainability, meaning we can't continue to go at the rate that we're going because our healthcare system is going to bankrupt us. And that is absolutely crazy. And we're 14th in quality.
Well, the funny thing about that is and anybody that watches the news or social media, I know they've heard all of the things like the GLP-1s and all of the name brand products that are out there. And if Medicaid and Medicare allows those drugs to be a part of their benefit package, cost billions of dollars a year. And most of those aren't even produced in our country. So those are being made in other countries that and they don't even allow their citizens to utilize them because they push nutrition,
Yep.
exercise, and they do other things besides going to those GLP-1s.
Well, we're the most obese nation on the planet.
So just because you're thinner doesn't mean you're healthier either. So we have a lot of skinny people that are nutrient deficient.
Sarcopenic. So, and here's a study that people will be familiar with the name, the Bloomberg Health Efficiency Index. So Bloomberg, in 2020, they looked at 55 countries. So this goes all the way back to 2020, and we haven't gotten better. We haven't moved up in the ranks with healthcare. We have gotten worse and worse and worse. Here is their index, last available 2020, 55 countries, life expectancy versus spending. We are near the bottom. We are 50th out of 55. Hong Kong is first, Singapore is second, Israel is third. And our weakness is in 2014, we spent $9,403 per person in the United States on healthcare. The data now, take a stab at what our cost of per person.
Was that in 2020?
That was 2020. So now we're at 2025. What is the cost per patient? Or
Well
per
over
person?
20 grand. I'm gonna say 23,000.
Wait, did you hear the bell ring? Did we get to school? What's up? We're here. Oh, come on, really?
You're high. It's 12.
Oh,
So
really?
so in 10 years, we added an additional $3,000. We haven't gotten better, and our life expectancy only went up by 1 year. So we went from 77 to 78.9. This is crazy. This is what our science gets us. And it goes back to that first study. The first study that says, hey, our intake is great. We're second in the world. Our nurses and the people doing the intake and the doctors that take the time and do the diagnosis, fabulous. And then what kills us? The tools we use drop us to last. So our science is absolute garbage. Those are independent studies. I didn't ask for them. Republicans didn't ask for them. Democrats didn't ask for them. Those are just the cold, hard facts. And if you don't like it, you shouldn't. You should be mad as Hades that we spend so much money to get such crappy returns. Our return on investment is absolute garbage. And I hear, oh, Switzerland's vaccination schedule is just like ours. They vaccinate, they do this. No, it isn't. Go look it up. If you look at, and this is not an anti-vax thing. This is a little science seems to be pretty good. A lot of science seems to be greed because at this point in time, their vaccination schedule mimics ours in the 1970s with about 5.
Are they forced or or is it their choice?
I have no idea. I didn't look at that. I just saw that their schedule mimics ours at about 1970. Ours now is well over, I've heard 72. When I go to research it, I can absolutely see 50 different doses,
And I've
not
heard
vaccine.
72, and if you aren't counting the doses that they're giving to pregnant women.
Okay. So, am I, and here's the funny thing. I don't think it's just the vaccine. I think it's our food system. I think that our food has made our bodies less resilient and we can't take the assault. And then we haven't stopped. As we've seen illnesses, chronic illnesses, and everything else continue to go up, we haven't stopped what we're doing. The first thing that you do when you realize you're in debt and you have no way out, what's the first thing you do? Stop spending.
Tighten your belt.
Yeah, stop spending. Quit trying to innovate because the innovation obviously is not working. We need to stop, assess, and pick a new route. Because if you keep going down the same path, you're going to get the same results. And that is the definition of insanity. If you keep doing the same thing over and over and think you're going to get a different result, you're a moron.
Well, do you think that we haven't like kind of over specialized?
Who knows? I
I-
feel like we've made health so complicated,
When-
and that's what.
You see 15 doctors and not one doctor talks to each other and nobody knows, and you're still not feeling good. And so that just sickens my heart.
I had this discussion with a family that we actually had come in. Why in the world do you have to be a doctor to know how to eat?
Well, and then the sad part about that is the doctors don't even know how to eat because this nutrition is not, it's not taught in medical school anymore. And so how do you go to a physician who is supposed to, depending on what age you are, a lot of people are all trusting of them, and yet they don't even know how to tell you how to take care of your body with food.
And when you look at life expectancy for Americans and health, so there is a difference between life expectancy, how long you're expected to live, and then it's your ability to not be disabled. And we are one of the worst countries at that. It's like we get done working when we're 60, and guess what? We have 3 years before we're disabled. We go from 60 to 63, and then we're beginning to have disabilities. We're the only country that's like that. Why? Once again, I'm not crushing on vaccine. I'm not. It is a much bigger problem. It has to take into account our lifestyles. When I have patients coming into me that on average are getting 4 hours of sleep, and we change their lives by moving their bedtime by 2 hours. This I'll sleep when I'm dead mentality. You're going to get your sleep sooner than later if you keep pushing that agenda.
I think that's a cultural thing for our country.
Yes, it is.
Because no other country in the world treats their citizens and expects so much out of them.
Well, what is it we hear? I mean, sorry, let's phrase that. We're the only like free country. If you're in one of those countries that isn't free and you are owned by the government, then you work for pennies. But we're one of the only countries that sits there and says, I'll sleep when I'm dead. I'm not here for a long time. I'm here for a good time. Well, guess what that gets you?
Well, I think we are just raised to hustle,
And that's okay. Work hard.
but we are killing ourselves hustling. Not much reward
Yes.
for the hustle.
And they call it the top 1% for a reason, because only 1% of people are going to be there. The chances that you're that 1%, 99% you're not. So you might as well do things that help you, that heal you, that don't fall into these numbers. If you are having to go see medical doctors and get pills when you're in your 20s and 30s and 40s, you are doing something drastically wrong.
Well, and I think that we do that to ourselves.
Yes.
We have done that to our, so consider value is I give you something, you give me something. Super bugs and things like that. We absolutely did that to ourselves because moms had sick babies, they take them to the doctor, they pay their fee, and they want a script. They want an antibiotic, they want a whatever. And so we have done that to ourselves. And we also are not proactive with health. So other countries value, so we hear this a lot, and I'm sure you've heard it, and I'm sure it's been told to you. And if you're young, it will be told to you, I'm sure. You're just at that age, blah, blah, blah. But pelvic health, pelvic floor health, we'll use that as an example. We are one of the only countries that our government doesn't prioritize pelvic health. Pelvic health starts when people have their first babies, whether that be 16, 20, 24, whatever. Governments actually in other countries fund the pelvic floor health rehab. In the United States, we do not. And we get women and men who become incontinent in older age, and that is not normal or typical and shouldn't be accepted. But that's just one example. We are not proactive with our health. We are reactive to our health.
So the interesting thing, if you look at, so I typed in, where did the United States rank in life expectancy in the 1970s? And we were ranked 13th out of the 60 populous countries. Now in 2025, we've dropped 2 spots to 15. Our science has not gotten us better. We haven't gotten better life expectancy, especially when compared to other countries. Our life expectancy did get a little bit larger, but when you compare us to other countries, we didn't get the same benefit that they did.
Well, and just because you gained or lost a little bit of life expectancy, what was the quality of those years?
Well, and that's
And
where
that's
our
the big
health
thing.
span
Okay, we're
is
gonna live
gone in
70
America.
70 years, but at 63, we're disabled. So the quality of those end of life years is not good.
Yeah, and it feeds wonderfully into that. Oh, you're going to need long term care. So you're going to need this long term health care insurance, and you're going to need this long term facility insurance. It's just absolutely nuts. Infant mortality ranking, deaths per 1,000 live births was a key indicator in the healthcare access and quality, especially in vulnerable populations. In 1970, the U.S. ranked 19.8 deaths per 1,000 live births, a record low at the time, but still unfavorable internationally. It, and it hasn't gotten much better. Among the industrialized or developed countries, about 25 nations are tracked by the U.S. The U.S. ranks 20th, and that's in infant mortality. So, I mean, it's absolutely, we spend the most money of any nation, and we have the worst outcomes. And when we start to break it down, the worst outcomes do not come from our people. They don't come from our doctors, and they don't come from our nurses. They come when we start to actually apply the tools, the science, the drugs to the process. And then we drop straight out the bottom. And you can go look that up.
You can thank Mr. Rockefeller.
Yeah, thank you, Mr. Rockefeller, and all the pharmaceutical company. Anyway,
What you up to, Ray Ray?
that's 30 minutes of a rant. We have children showing up, so looks like somebody's learning how to play soccer.
Yeah.
You have a wonderful evening. We'll see you next time.